What if your next medical test did more harm than good? The truth about senior health checkups, what's really helping and what could be harming. If you're over 60 or 70, chances are you've heard this before. Early detection saves lives. Your doctor recommends another scan, another screening, another test, and of course, you agree. Because we've all been taught that the more we monitor our health, the longer and better we live. But here's the shocking truth. According to global research and leading medical journals, many of the most common medical tests recommended for older adults may offer little to no benefit after a certain age. In fact, some can cause serious harm, leading to unnecessary medications, surgeries, and emotional distress. And the worst part? This is happening not just in the US, but in health systems around the world. From the UK to Canada, Australia to India, seniors are being pulled into a medical system that often favors detection over discernment and protocol over personalized care. Today, we're lifting the curtain on a topic very few talk about: the dark side of overtesting and aging. We're breaking down 5 common medical tests that seniors over 60 and 70 are routinely urged to get, and explaining why, in many cases, they may be more harmful than helpful. These are tests your parents, your grandparents, or maybe even you are scheduled for right now. But what's the evidence? What are the risks? And what should you do instead? If you care about aging with dignity, independence, and clarity, this video could be one of the most important things you watch this year. Test 1. Bone density scan. Let's begin with a test that sounds incredibly routine, almost harmless. The bone density scan, also called the DEXA scan. It's a quick X-ray, usually of your hip or spine, that measures how much calcium and other minerals are packed into your bones. The goal? To assess your risk of fractures due to osteoporosis. Now, at first glance, this sounds entirely reasonable, especially since we associate aging with weaker bones. But here's the nuance most people, even many healthcare providers, don't talk about. The DEXA scan reports your results as a T-score, a comparison of your bone density to that of a healthy 30-year-old. Yes, you heard that right. Seniors in their 70s and 80s are being compared to people at their physical prime, which automatically skews the results towards showing bone loss. So what does that lead to? A diagnosis of osteopenia, a fancy term that simply means lower than average bone density, but not yet osteoporosis. It's important to understand that osteopenia is not a disease, it's a risk category, not a guarantee of fractures. But here's the problem. Once this label is given, many older adults are immediately prescribed medication, usually a class of drugs called bisphosphonates like alendronate, fosazam, risodronate, or zoledronic acid. In a massive review conducted by the independent Cochrane collaboration, researchers analyzed the effects of bisphosphonates in postmenopausal women and older adults. In people over 75 without a prior fracture, the benefit of these medications was almost negligible. For example, the number of hip fractures prevented was statistically insignificant, while the risk of serious side effects was far more tangible. What kind of side effects are we talking about? These drugs have been linked to osteonecrosis of the jaw, literally the death of jawbone tissue, esophageal ulcers and inflammation, atypical femur fractures, a rare but serious kind of thigh bone break that can happen suddenly, debilitating bone and muscle pain. These are not just mild inconveniences. They can lead to surgery, hospitalization, and even permanent disability in older adults. The problem of overtreatment. Now, to be clear, this doesn't mean bone density doesn't matter. It absolutely does. Fractures in old age, especially hip fractures, can lead to a cascade of complications: loss of independence, long rehab, even increased mortality. But the solution is not always in the scan or the pill. What we're seeing in modern medicine is a pattern of overtreatment, where numbers on a test override common sense, context, and individual risk. A 74-year-old woman who walks every day, eats well, has no history of falls, and feels strong may not need to be medicated just because a scan says her bones are a little thinner than average. What to do instead? Functional prevention. So if bone density scans are overused and medication is often unnecessary, what should seniors over 70 focus on to protect their bones? The answer lies in function-based prevention. That means improving the things that actually reduce fracture risk. Weight-bearing exercises, like walking, hiking, and stair climbing, help stimulate bone growth. Resistance training, lifting light weights or using resistance bands, strengthens muscles, which stabilize joints and prevent falls. Vitamin D and calcium, not just from pills but from sunlight, leafy greens, dairy, and fortified foods. Fall-proofing your environment, removing loose rugs, improving lighting, installing grab bars in bathrooms. Balance and coordination training like Tai Chi, yoga, or even dancing, all proven to reduce fall risk in seniors. In summary, the DEXA scan is not evil, but in people over 70, especially those without a history of fractures or symptoms, its value is often overstated, and the treatment that follows can do more harm than good. Instead of chasing numbers on a printout, seniors should be encouraged to build strength, maintain balance, and live actively. That's real prevention, and it's backed by decades of data, not just protocols. Talk to your doctor, ask questions, and remember, not every scan is necessary just because it's available. The best medicine is often found in movement, nutrition, and informed choices. Is that MRI really necessary? Or is it just feeding the fear? Next up is one of the most anxiety-driven decisions in modern medicine: the brain MRI for memory loss. We all know that fear: misplacing your keys, forgetting why you walked into a room, or momentarily blanking on someone's name. For seniors over 70, these experiences can trigger deep concern. In a world where Alzheimer's disease and dementia dominate headlines, it's no wonder that when these small lapses start appearing, the first response, both from patients and doctors, is often, "Let's get an MRI just to be safe." But here's the truth, backed by a growing body of global research. For most older adults with mild memory complaints, brain MRIs add little and can even cause unnecessary harm. What the science really says. In a 2019 study published in the journal European Neurology, researchers looked at brain MRIs in adults over 70 who were being evaluated for memory issues. The result? Over 85% of scans showed age-related changes, not signs of disease. What kind of changes? Things like white matter hyperintensities, tiny spots on the scan that look scary but are often just signs of aging blood vessels, or cortical atrophy, which simply means brain shrinkage, a normal part of aging, like gray hair or wrinkled skin. These findings are often labeled as non-specific or inconclusive, yet the emotional impact on patients and families can be devastating. You hear the words white matter lesions and immediately think stroke, dementia, irreversible damage. Inconclusive MRI results often cause more anxiety than clarity. The downstream dangers of unnecessary scans. But it doesn't stop there. These vague MRI results often lead to a chain reaction of follow-up tests, PET scans, lumbar punctures, even brain biopsies in some cases, all with high cost, low yield, and significant emotional distress. Not to mention the possibility of being misdiagnosed or prematurely labeled with cognitive decline, which can affect everything from insurance policies to mental health to how families treat their aging loved ones. And here's the real kicker. None of this has been shown to improve outcomes in patients with mild symptoms. What actually works? Clinical cognitive screening. So, if an MRI isn't the first step, what is? The answer lies in something far simpler, faster, and more evidence-based: clinical cognitive screening. Standardized paper-based tests like the Mini Mental State Exam, MMSE, Montreal Cognitive Assessment, MOCA, or clock drawing test can give trained clinicians a surprisingly accurate picture of cognitive function, especially in the early stages. These tests measure things like memory, attention, language orientation, and executive function, and can be completed in under 15 minutes. They don't expose you to radiation, they don't cost thousands of dollars, and they don't leave you with vague, fear-inducing scan reports. On-screen text. Simple clinical tools often detect memory loss as well as advanced imaging without the stress, when a brain MRI is appropriate. Now let's be clear. There are situations where a brain MRI is appropriate and even urgent. If someone is experiencing rapid memory decline over weeks or months, sudden changes in personality or behavior, new onset seizures, difficulty with movement or speaking, history of cancer with new neurological symptoms, then yes, imaging may help identify serious but potentially treatable conditions like strokes, tumors, or infections. But these are not the typical cases of, "Where did I leave my glasses?" or "What was that actor's name again?" Those small lapses are often part of normal aging, especially when they're not interfering with daily life. Perspective over panic. What we're really talking about here is a shift in perspective. Memory changes with age are not always pathological, and reacting with panic and expensive imaging can sometimes do more harm than good. In fact, several international guidelines, including those from Canada, Australia, and the UK, now recommend against routine brain imaging for mild cognitive symptoms unless there are specific red flags. Instead, they emphasize lifestyle interventions that can improve brain health at any age. Staying socially engaged, regular physical activity, mental stimulation, reading, puzzles, learning new skills, quality sleep, managing blood pressure, diabetes, and hearing loss. Final takeaway, trust function over fear. So before you or someone you love rushes to get a brain scan over mild memory issues, pause. Ask, is this normal forgetfulness, or is it truly interfering with daily life? Start with a simple cognitive screening. Talk to your doctor about lifestyle factors, medications, and stress. And remember, not all forgetting is the beginning of decline. In the quest to stay ahead of disease, we sometimes forget that aging itself is not a diagnosis. It's a journey. And how we navigate it matters more than how many machines we use along the way. Worry less about every lapse and focus more on how you live. Dr. Helen Lavretsky, geriatric psychiatrist, UCLA, Section 3. Colon cancer. Screening after 75. Screening isn't always saving lives. Sometimes it's just extending fear. Let's talk about colon cancer screening. Now, colonoscopies are often portrayed as life-saving. And for many adults between 50 and 74, that's absolutely true. Early detection of colorectal cancer through screening does save lives. But what happens after age 75? Here's where the story changes and gets more complicated. The data shift after 75. According to major international studies, including long-term analyses from Canada, Europe, and the US, the benefits of routine colon cancer screening drop significantly after age 75. Why? Because the progression of colorectal cancer is typically slow, and the average time from polyp to cancer is 10 to 15 years. So, if a polyp is discovered at age 76, but the person has multiple other chronic conditions or a limited life expectancy, it may never become a threat during their lifetime. But the colonoscopy and everything that comes with it still carries risk. The procedure isn't risk-free. Colonoscopy is not a harmless test. It requires full bowel prep, sedation, and the insertion of a scope into the colon, and it carries real complications, especially in older adults. The most common risks: perforation of the colon, a tear in the colon wall that can lead to emergency surgery, severe bleeding, especially after polyp removal, cardiac or respiratory issues from sedation, dehydration, dizziness, or falls from bowel prep in frail individuals. A 2020 study published in JAMA Internal Medicine found that complication rates increased dramatically after age 75, particularly in those with other health conditions. The problem of false positives and anxiety. There's also the psychological cost. Colonoscopies can lead to incidental findings, things that may never cause harm but trigger a cascade of follow-up tests, biopsies, and even surgeries. You might spend months dealing with the fallout of a suspicious polyp that turns out to be benign, but only after multiple tests, stress, and financial burden, when screening still makes sense. Now, should everyone over 75 stop screening? Not necessarily. It depends on your overall health, not just your age. If you're 76 and in excellent health, with no major chronic conditions and a life expectancy of 10+ years, and especially if you've never been screened before, colonoscopy may still be worthwhile. But if you've had regular screenings with clear results and you're now in your late 70s or 80s, continuing may do more harm than good. A personalized approach is best. The most responsible approach is a personalized one, not a one-size-fits-all rule. Talk with your doctor about your screening history, your life expectancy, your chronic conditions, the risks versus benefits in your specific case. After 75, screening should be guided by health status, not habit. Doing less can sometimes be the most compassionate form of care. Dr. Deborah Kornstein, Memorial Sloan Kettering, Section 4, Annual ECGs, electrocardiograms. In low-risk seniors, more testing doesn't always mean better heart care. Next up, a test that seems completely harmless. Even routine, the annual ECG or electrocardiogram. This test records the electrical signals in your heart and can detect arrhythmias, past heart attacks, and certain other conditions. It's quick, painless, and inexpensive. So what's the harm, right? The problem of screening in low-risk people. Here's the catch. In healthy seniors with no symptoms and no history of heart disease, annual ECGs don't improve outcomes. That's according to global recommendations from cardiology societies in Canada, the UK, the US, and Australia. Why? Because an ECG is not a predictive tool, it's a snapshot. And in someone without symptoms, it often detects incidental findings. Tiny irregularities that may be completely benign, but once found can open the floodgates. Think stress tests, echocardiograms, Holter monitors, even unnecessary cardiac catheterizations, all triggered by a single abnormal ECG that may have meant nothing. Overdiagnosis, overtreatment harm. In fact, a 2018 study in BMJ Open found that routine ECGs in low-risk patients led to significant overdiagnosis and overtreatment, including medication side effects, invasive procedures, and hospitalizations that did not improve mortality. Common consequences include mislabeling of harmless arrhythmias, anxiety and unnecessary follow-ups, prescription of blood thinners or beta blockers with side effects like fatigue, dizziness, or bleeding. When is an ECG actually useful? Let's be clear, ECGs are extremely valuable when used correctly. If you're having chest pain, palpitations, shortness of breath, dizziness, leg swelling or unexplained fatigue, then yes, an ECG can help diagnose serious conditions like atrial fibrillation or heart failure. But for routine, annual use in someone feeling fine, the evidence simply isn't there. The safer path. Manage risks, not just readings. Instead of chasing readings on a machine, focus on reducing your real cardiac risk with proven strategies, controlling blood pressure, eating a heart-healthy diet, think Mediterranean, staying physically active, managing cholesterol and diabetes, quitting smoking, staying socially connected, and reducing stress. A healthy lifestyle is more powerful than any machine. Final takeaway, test without context, create noise. In modern medicine, we often assume that more testing equals better care. But in seniors, especially those without symptoms, tests without a clear reason can create confusion, anxiety, and harm. Let data guide decisions, not fear, not habit, and not checklists. In low-risk people, testing hearts can sometimes break them. Dr. Rita Redberg, cardiologist, UCSF. Section 5 in the last kind of test seniors. Over 70 should rethink the risks no one talks about. Full-body CT, scans in healthy seniors, peace of mind or Pandora's box? Now, let's talk about one of the most seductive yet dangerous trends in healthcare, the full-body CT scan, marketed as a futuristic way to catch everything early. This scan is often sold as the ultimate peace of mind package. No symptoms, no problem. Just lie back, and in minutes we'll scan your brain, chest, abdomen, pelvis, all of it. Sounds like smart prevention, right? Wrong. For healthy seniors, and even middle-aged adults, routine full-body CT scans may do more harm than good. CT technology, Incredibly powerful, but not a crystal ball. Let's be clear, CT scans are medical marvels. They can detect tumors, aneurysms, blood clots, and more. But they're designed to be used when there's a reason, a symptom, a risk factor, a red flag. When used indiscriminately, they don't prevent disease, they provoke overreaction. Multiple studies from around the world, including research from the UK's NHS and the Canadian Task Force on Preventive Healthcare, have found that full-body scans in asymptomatic adults rarely find anything life-saving. Instead, they uncover what doctors call incidentalomas, harmless or unclear findings that trigger anxiety, biopsies, surgeries, and radiation, with no improvement in longevity or quality of life. The dangerous domino effect of incidental findings. Here's how it plays out. Step 1, you get a full-body CT. Step 2, it shows a small lung nodule, kidney cyst, or adrenal growth, all common in older adults. Step 3, doctors don't know what to make of it, so you undergo more scans, invasive tests, or even surgery. Step 4, weeks of worry, thousands in bills, and sometimes complications or harm from procedures that weren't needed in the first place. A 2021 study in the Lancet Oncology found that false positives in follow-up procedures from whole-body scans led to a significant increase in patient anxiety and no difference in mortality after 10 years. Over 40% of whole-body scans in seniors find abnormalities, most of which are meaningless. Hidden risk, radiation exposure. There's another risk that's often ignored, radiation. A single full-body CT scan exposes you to as much radiation as 200 chest X-rays. For older adults, the risk of radiation-induced cancer is lower than in younger people, but it's not zero. And when these scans are repeated every year, which some companies recommend, the cumulative exposure becomes medically irresponsible. Ironically, in trying to catch cancer early, these scans may increase cancer risk down the line. A profitable fear industry, not patient-centered care. Let's also talk about the industry behind it. Many full-body CT scans aren't recommended by your doctor. They're sold directly to consumers with glossy brochures, celebrity endorsements, and promises of total health awareness. But they're not regulated like traditional medical tests, and they're not covered by most national health guidelines. Why? Because there's no evidence they improve outcomes, and strong evidence they lead to unnecessary harm. It's a business, and fear is the product. So what's the better alternative? Instead of trying to scan our way into security, the safer and smarter path is to focus on evidence-based targeted screening. For example, colonoscopy, up to age 75 if indicated, mammography, up to 74 in women at risk. Low-dose CT for long-term smokers, as per lung cancer screening guidelines. Cardiovascular risk assessments, blood pressure, cholesterol, diabetes checks. And perhaps most importantly, invest in what we know extends life and protects health. Check exercise, check nutrition, check sleep, check social connection, check stress management. Final takeaway: don't scan for the sake of scanning. The idea of knowing everything that's going on inside your body sounds empowering, but in reality, knowledge without context creates chaos. Just because we can look everywhere doesn't mean we should, and just because something is found doesn't mean it's dangerous. Medicine is about people, not pixels. It's about listening to your body, yes, but also trusting the wisdom of restraint. Full-body scans are the stethoscopes of the worried well. Powerful, but too often misused. Dr. H. Gilbert Welch, Dartmouth Institute for Health Policy. More care doesn't always mean better care. As we age, it's natural to want certainty, to want answers, protection, and reassurance that we're doing everything possible to stay healthy. But in modern medicine, more tests, more scans, and more procedures don't always translate into more life, more safety, or more peace. In fact, for many healthy older adults, the opposite is true. From testing to trusting. The truth is, aging bodies will change. Our scans will show spots. Our hearts will skip beats. Our bones will thin, but not every finding is a threat, and not every discovery demands action. There's a difference between being informed and being trapped in the cycle of over-medicalization, where every tiny abnormality becomes a problem to fix, rather than a variation to respect. Good medicine isn't just about detecting disease. It's about protecting quality of life, minimizing harm, and making room for wisdom, not just intervention. Choose wisely, live fully. So what should you take away from all this? That real prevention is not rooted in fear, it's built on movement, nourishment, relationships, rest, purpose, and thoughtful, appropriate medical care. That more is not always better, and sometimes doing less is the most compassionate, intelligent choice. To our viewers, empower yourself with truth. If you or a loved one are over 70, take this video as a gentle reminder to ask better questions. Is this test necessary? What will I do with the results? What are the risks of knowing more? Empower yourself with information and trust that saying no to unnecessary testing is not neglect, it's wisdom. Subscribe and follow. If you found this video enlightening, we invite you to subscribe to the channel Echoes of Elderly Wisdom and share it with those you care about. Let's shift the conversation around aging from one of fear to one of informed, empowered living. Your health journey doesn't need more noise. It needs clarity, courage, and community. And that's what we're building here, one honest video at a time. In medicine, as in life, the hardest wisdom is knowing when to stop searching and start living.